So basically, the first topic is electronic health records. Let's start with a basic introduction to what electronic health records is. The term electronic health records is the most commonly accepted term for any software with a full range of functionalities to store, access, and use patient medical information. So basically, we're talking about a software that allows the doctor to access the patient information, okay? So basically, instead of having the patient records in the form of hard copy, like films, like charts, like lab analysis reports, like previous prescription, whatever the patient had before. Basically, we're going to replace that with a software and the database that has all the information of the patient in an electronic form. The reason why people actually thought about electronic health records, imagine that a patient is going to a doctor, or basically a patient is traveling somewhere, and he had to visit a hospital because of a health problem, okay? The doctor in the hospital basically doesn't know anything about the history of that patient. As you know, some patients may have allergies, some patients may have certain pre-existing conditions, or basically some chronic conditions or things of that sort. If the patient is not able to communicate the previous conditions and all the allergies and all these kinds of things to the doctor, he might prescribe something that might be really dangerous to him. Okay, so this is a big problem. So basically, as medical care became more complex, doctors realized that in certain situations, the patient's complete health history would not be accessible to them. For example, if a patient is traveling and he had an accident and he's in a coma, okay, he will not be able to basically communicate anything with the doctor. So basically, the doctor has to try to find out, or basically try to prescribe some medications or some treatment without knowing his medical history. And there might be something that has a conflict with an allergy or something like that, and maybe the danger would not come from the initial injury, but from actually the drug interaction with the patient condition. So basically, when the doctors realized that the patient information in the form of a file in the original hospital of the patient might not be accessible to whoever doctor is treating that patient. So basically, they thought about ways of making that file accessible to them anywhere. Okay, so basically, the availability of comprehensive medical information when needed, this is the most important thing, brought about the innovation of storing patient information electronically. So basically, this is the main reason why people thought about electronic health records. Basically, improvement of patient medical care was and is the catalyst for EHR, for the presence of electronic health records. So basically, this motivated the innovation of electronic health records and is the catalyst basically for further development of electronic health records. The doctors would like to have the patient records anywhere so that whenever this patient has to go to a hospital somewhere, the patient record should be accessible to that hospital so that the best possible medical care is given to that patient. Okay, so whenever you know the complete history, your chances of making mistakes is much less. So the patient medical care is much better when you have the comprehensive medical information of each patient. Add to that, one very important thing, I think we all noticed that, basically we have now affordability of both the hardware and software. And also we have reliability of the internet. Imagine the situation maybe 10 years ago, not 20 years ago. Actually, when the EHR was basically being introduced, it was like 20, 25, almost 30 years ago. If you think about the internet 10 years ago, it's much different than now. If you think about the hardware that was available 10 years ago, it's much less powerful than what we have now. And it's much more expensive. Okay, so basically now we have affordable hardware. We have lots of software companies. We have lots of software options in general, okay? And we have much more reliable internet, and we have networking devices that would allow intranet technology to be available. Intranet meaning that a network within an organization. So basically, if you are in a hospital, you're able to access the filing cabinet. Basically, if you have a certain server within the hospital, it's very easy if you are within the hospital or even in another branch of that hospital to access the patient files that are stored on the servers of the hospital. So this is much easier. And also you have wireless internet, wireless connectivity. So basically you can access it from anywhere virtually, okay? So basically if you have a problem connecting to all places, basically you can cover the rest of the places in the hospital actually with wireless connectivity. So instead of having a wired connection, you can have wireless connectivity, and basically this makes things much easier. And you can actually connect everywhere without having to basically do a lot of work and basically have cables passing through the walls and things of that sort. Okay, so actually, you know, the affordability and the availability of such things enabled even some independent physicians, not hospitals, not just hospitals, some independent physicians actually are basically tapping into this EHR technology. So basically you can go to an independent physician in a clinic somewhere, and basically this clinician actually has a connection that allows him to access your medical record from wherever it is. So basically, we're talking about a technology that would make the medical history of patients available to their caregivers, to the medical caregivers, basically, whoever they are and wherever they are. Please stop me anytime if you have any question. Don't wait until I finish, okay? So you can interrupt me anytime and ask any questions you want, okay? So basically, there are so many terms, as with any technology. Sometimes you have a certain common terminology, but there are other terminologies that some people use in some contexts. So basically, some people call EHR, sometimes they call it electronic medical record, EMR, okay? Basically, just to be honest, basically all these terminologies actually can be the full functional EHR, but sometimes EMR is used when you have a software that lacks a full range of higher end functionalities, okay? But actually this is not, basically this is like a reason why there is an EMR terminology, but actually sometimes EMR means exactly EHR, okay? So basic EMR is like a basic version of the EHR, okay? But sometimes EMR can be upgraded to be basically just like EHR. Sometimes they call it CPR, computer-based patient record. As you see, it's the same meaning basically. Where you have basically lifetime patient record, including all the information from all specialties and available to all providers. Basically, this is EHR actually. There's not much difference actually. But sometimes it's actually very common when you have, yes.
Sorry, just I joined around 6:30, and I found you started in the introduction. So you started at 6:25.
No, actually, I actually use the computer time, so I'm not sure.
So okay, 6:30 you started. I can come back to it at recordings. It's recorded, right?
Yes, yes. But actually, I use the computer time, so basically it should be okay. It should be exactly the same as the mobile. It's basically synchronized with the the universal clock, so it should be accurate.
Okay, this is
I'm not sure. I'm not sure.
No problem.
Yes.
But this is the first chapter, which is where can I find it in the
Electronic health records. Electronic health records.
Okay.
Okay. Okay. For the people who attended from the beginning, I think there were like 4 or 5 people. Was it 6:30 or was it before 6:30?
It's exactly 6:30, doctor.
Okay. Okay, that's fine. Okay. I think we should just make the computer time as our basic reference. Okay, so we don't get confused. Okay. Do you have a class before this one? For the student
For me,
who
no.
came a little bit?
No.
No, for the student who came 5 minutes after? The student who mentioned that I started early? Did you have a class before this one?
I'm the one who mentioned that. No. I don't.
Yes, Doctor, I have a class.
So basically, okay. Would you like to start? Would you like that we start at 6:35 after that? Yeah, so that you can have enough time between the two classes.
No, it's at 63. Okay, no problem.
Okay. So next time, inshallah, I will start at 6:35. Okay. Okay, let's continue. We have another terminology called EPR, electronic patient record. Okay. Basically, sometimes they actually use this as a more limited version of EHR, where you have only the most relevant information. Okay. Relevance depends on the kind of condition that the patient has, and basically this is kind of a vague terminology, and usually you don't really pick and choose from the patient information. You should have actually all the information and let the doctor decide which is relevant and which is not. Okay, so basically if you're going to focus, if the software is going to focus on something, I think it's not a good idea. So basically this is not a very good thing to have actually. But also you can have EPRs or systems that are called EPR that exactly function like EHR. By the way, I was going to say that such terminologies actually usually arise from vendors. Vendors are the companies that offer these kinds of softwares. Okay, so basically sometimes in order for you to find a certain advantage against your competitors, you probably want to say that my software is a little different. Okay, so if you call all the softwares at EHRs, then basically all are the same. So basically come up with such I don't know, such terminologies that are very similar to EHR, but they are slightly different. And they claim that this is better, their software is better because it, for example, here, it focuses on the most relevant information, for example, okay? So it's most efficient for the doctor, for example, okay? But actually, in reality, basically, if you have any software that has any of these terminologies, it's very likely to be exactly the same. You have CCR, what's called continuity of care record, and basically it's the health provider oriented core set of most relevant and timely data. Basically, it's kind of, again, a subset of EHR, but this is actually oriented towards the health provider, basically. So for example, if that patient has certain condition like chronic condition, for example, so the health provider has to manage the, for example, if he has a certain medication that he has to take every month, for example. So basically, this is very relevant to the healthcare provider because this is a cost that is recurring, that is basically continuous, that keeps basically coming every month. Okay, so sometimes it's from the point of view of the health provider, for the company like the hospital, not the doctor, the hospital, it might be better to have a record that focuses on the cost elements that are basically repetitive, that keep coming back, basically. PHR, what's called personal health record, basically, what they call it here is a patient access via internet to store and update personal medical information and make inquiries. Okay, so basically here, this is basically intended for the patient. But actually, as we're going to learn, EHR should be accessible by both the patient and the doctor and the healthcare provider. Okay, so basically all these terminologies, in spite of their claim that they are a little bit different from EHR, they are exactly the same. Okay, they might focus on something, but actually, if they're going to meet the standards for EHR, they have to all have the same information. Okay, so basically let's just consider these as acronyms, as basically other terms that can be used to describe EHR.
Sorry, doctor.
Why do we? Yes, go ahead.
Once I have a discussion with this term that I googling also with difference between EMR and EHR, that the differences is in case of the sharing data sharing. So like EMR is only provided for only hospitals, but EHR it can be used for many hospitals. It's something like that, doctor.
Actually, in reality, it's not like that. Okay, okay.
Okay.
Sometimes when you Google, you're gonna get the same kind of information that basically the textbook may have, but actually in reality, there isn't much difference, because if you're going to comply with the standard that you're going to talk about, you have to allow access basically to the doctor, to the hospital, to any healthcare provider that has interaction with that patient. So basically they should be the same. Otherwise they will not be useful. Okay. So basically let's just consider them as maybe different versions of EHR. Okay. They are not very different from EHR. I cannot say that they are different. They are not different. They are basically maybe some versions of EHR. So basically you have to meet the basic functionalities of EHR.
Excuse me, Doctor.
So yes.
Do we speak about the patient profile, their appointment, or just diagnose and laboratory and something like
Everything,
this?
Everything.
Because
Basically,
I heard about the Ministry of Health, they do right now the unified patient file.
Yes, yes. This is very much EHR.
Mm-hmm.
Okay, this is basic. As we're going to learn, this is basically the functionality of EHR. They call it patient file. Okay, this is another name, another term. Okay, but actually this is at the basic level. If you look about the functionalities that you're going to talk about, it's basically EHR. And basically, I'm going to show you an example. At the end of this lecture, I'm going to refer you to a website where you can download a demo version of an EHR system, okay, that the textbook is providing. Basically, the textbook actually is an excellent textbook because it's very practical. And all the chapters of this textbook actually are examples on a particular EHR. So they give this EHR to you to download, and basically you can basically interact with that software, and you will see that you can arrange appointments for a patient. You can actually prescribe medications for that patient. You can view the previous charts of that patient, like radiology, films, ECG, lab results, things of that sort. You can do whatever you want, okay? You can basically export this data to somebody else. Basically, if you want to share this information with another provider, you can do that. So basically, this is one of the things that you're going to do as part of this course, so that you basically get a better feel of how EHR works. So now we're going to talk about the benefits of EHR. Why do we need EHR? What is the real value of EHR? First of all, you have better clinic information and accessibility. So basically, doctor can access past medical history, family medical history, immunization records, etc. So basically, it's not just that the patient, you basically can also have family medical history. A very interesting actually addition to that, actually going to find in the software I'm talking about, the demo software version I'm talking about, you can actually search. If you have a certain patient, you can search for other patients that live in the same exact address as this patient. So basically, if you suspect a certain infection or something like that, you can actually look for the people who live with that person, with that patient, and make sure that they don't have the condition that you're suspecting. Okay, so basically, it's not just the patient, just one patient alone. No, you're talking about the patient and his family and his basically the people who are living with him, the network that basically surround that patient, so that you can actually make very good or informed decisions about the patient condition. So basically, it's you have access to past medical history. You can also have access to whatever medical history of his family or her family, because basically this is important in diagnosing some of the diseases or prescribing some of the diagnostic tests. For example, for women above a certain age, like 40, it's recommended to have a mammography every 2 to 3 years, so that basically you can prevent the onset of or detect early beginnings of breast cancer. Okay, but if that woman has a family history of breast cancer, then it becomes like 1 year, every 1 year. It has to do that yearly, every year. Okay, so it's very important when the doctor prescribes a certain diagnostic test to know exactly the family history so that he can make the right decision for that particular patient. Okay. Also, the immunization records. We all heard about the very unusual event that happened in Australia about that Serbian player who actually went there without immunization. And basically, nobody knew actually if he has immunization or not. Okay, basically they did not disclose that, and basically nobody was able to access his medical records to know if he's immunized or not. So basically, it caused a lot of problems. So basically, it's very important to also know the immunization records, because sometimes, yes.
سوري immunization يعني انت تعني له كملقح.
Vaccination, yes.
Yeah, ايوه okay.
Immunization is vaccination, okay.
So basically الحالة اللي صارت في صربيا في استراليا اللاعب التنس.
Yes. Yes. And basically it was they could not access his medical history, and basically the information he disclosed was basically misguided, or basically misguided them. So basically it caused a lot of problems. If the medical history of that person was accessible, to the medical people, or basically in Australia, it would have been very easy actually to make the decision very quickly. But it took longer than expected. He actually had to go there and basically, be refused entry to basically, because actually he did not provide evidence that he was immunized. So basically, if that was accessible to them before he went, that would have made it much easier. He would have been rejected visa, and that's it. He didn't have to go. So basically, it's better to have the information and accessibility of the information, because this will affect the decisions of the doctor. Okay, this is very important. Okay, not just because of the medical history of the patient, but also the family history, and also the people who live with that particular person in the same address. It's very important also to have EHR because of the patient safety. Okay, basically you have for EHR, whenever the patient has any additional testing or any additional diagnostic test, it would appear right away in his electronic health records. Imagine it's very similar to what you have right now on toEHR. Okay, you have whenever you do basic a corona test or something like that, it appears right away on toEHR. Okay, if there is any problem, it would appear right away there. Okay, if you got immunization, it would appear right away there. But this is a very limited version to basic the present situation for the coronavirus. Imagine that you have something like that expanded to all the medical conditions of the patient and medical tests and everything. Okay, so basically it will contain everything like test results, like routine and current medications. Like routine is like if you have a chronic disease, like a disease that is like diabetes or like blood pressure, hypertension, things of that sort. Basically, this is routine. Basically, the patient has to keep taking these medications forever. Current medications are the medications that are given for an acute condition. Acute condition is like a temporary condition. Like, for example, somebody has, for example, he ate something that that wasn't very clean, and basically had to take some medications to basically clean up his stomach, something like that. Okay, so basically this is temporary. The patient is taking this kind of medication for a limited time, and that's it. But you would know it right away from the EHR, and you will have right away if you have any allergies which is extremely important, because sometimes, basically, whenever you get to go and get the vaccine here, the coronavirus vaccine, they will ask you if you have any allergies. This is very important because some people actually can be exempted from taking the vaccine because they might have allergy to that vaccine. Basically, you have allergic reaction, and this allergic reaction can be very dangerous. Okay, so knowing the allergies is very important. Knowing the medication is extremely important. Why? Because basically, if the doctor is going to prescribe another medication, basically they use RX like prescription. This is the symbol for prescription. If he's going to basically put some more medication to this patient, some medication might interact negatively with the current medications. Basically, you have conflict between some medications and each other. Sometimes if the patient is taking like a medication for basically, what do you call it? If you have blood pressure medication, for example, and you take another medication that would basically make that blood pressure medication ineffective, that would cause a really big problem. So basically, there is, whenever you prescribe, you have to know exactly what the patient is taking. And basically, there is a very comprehensive drug interaction tables. Basically tell you that this particular medication cannot be taken with this particular medication. You can find this information in the pamphlet that is inside the medication, the box of the medication, but actually nobody reads it. Okay, the doctor should know that. For EHR, actually, what you're going to see is that whenever the doctor prescribes the medication, he prescribes that medication from within the EHR. And the EHR checks that medication against the known drug interactions with the present and the routine medications that the patient is taking. And if there is any conflict, it would actually give an alarm to the doctor right away, so that he can actually prescribe another version or another different medication that does not have that interaction. So this is extremely important. For the allergy, if you give the patient a medication that would trigger an allergy, this can actually lead to his death. And this is extremely important. Okay, so basically, this is also one of the things that the EHR, whenever the doctor prescribes a medication to a patient, it would actually check right away with the known allergies of that patient from his record, and basically ensures that this medication is not going to cause any problems to that patient. So it's extremely important. This is basically, we're talking about patient safety. Okay, so the idea of just going to the doctor and the doctor would just look at you and give you a medication and that's it, without knowing the history, is basically obsolete, basically right now. Because many people actually are taking medications all the time. So basically you have many people with chronic diseases who are taking medications. Many people now have allergies, more allergies than before, like 100 years ago or something like that. I'm not sure why. Maybe because of the type of nutrition we have, or type of processed foods that we have. But actually allergies are much more frequent now than before. So basically it's extremely important for the doctor to be aware of the condition of the patient, of the allergies of the patient, of whatever medication he's taking, before prescribing anything additional. Okay? So this is one very important advantage or a benefit of EHR. This is basically the most important. Basically, it allows you to have better patient care. And basically, this is a little bit advanced, but actually this is used in most of the, basically if you have a country with a good healthcare practice, basically you have standard practices for each one of the diseases, okay? What you call it, you have a protocol, a treatment protocol or diagnostic protocol. So for example, if the patient, actually here, probably one of the best countries in the world in the diagnostic and treatment practices for corona is probably here in the kingdom, actually. Okay, if you look at the numbers of the people who got infected and basically the mortality rate, it's much less than many other countries actually. If you talk about the US or England or whatever. So basically there is a very good protocol for how to diagnose and how to treat the patient, and basically this is followed by everyone. Okay, here we're talking about everything, not just coronavirus. Okay, so for example, if the patient is suspected to have a cancer, for example, okay, so basically he was doing something routine like a blood test or something like that, and there is something that came up in that particular test that would flag the possibility of having a certain type of cancer. If this particular type of cancer has a protocol, has a diagnostic protocol, then you have to confirm first that you have this type of cancer by doing additional tests that is like 1, 2, 3. So basically, if 1 is positive, then you move to 2 to confirm. And then you move to 3. If 3 is okay, then he's confirmed to have that particular type of disease. If you have a treatment protocol, then this patient has to basically start, for example, if he has a certain type of cancer, he would start with chemical therapy, for example, okay, chemotherapy. And then he might move to radiotherapy. And basically, if this doesn't work, maybe he should move to surgery, for example, okay? Imagine that you have a system that would actually notice or look at the numbers of the patient and suggest to the doctor that this might have this kind of disease, and basically suggest to him or basically give him the protocol that should be used for this, the standard protocol that should be used for this particular disease. We're talking here about better patient care. You allow the patient to get a standardized care everywhere. Instead of going, for example, if it's going like the usual random way of doing things, so basically if you go to a good doctor, then you get a good treatment, okay? If you go to a doctor that is less experienced, okay, or basically was too busy to look into your case without being distracted by other things, basically he might give you something that might not work, okay? So basically, here you're talking about trying to standardize patient care according to the best practices, to the best possible practice. Basically, the practices that are recommended by the experts are recommended to the doctor so that he can prescribe them. And this is really good. The final thing is efficiency. Efficiency means that you're minimizing a lot of costs. Like, for example, you're minimizing the paper costs. Basically, imagine that for each patient, you have a file. This file will have all the prescriptions, doctor prescriptions, where the medications are written. You have all the charts, like ECG, like if he does any lab reports, if he does any diagnostic reports, like diagnostic imaging, like MRI files or MRI films or X-ray films or ultrasound films, things of that sort. Basically, this file will be huge in size. First of all, you have to print all these things out. So basically, you have paper cost. You have a problem that this file will never go small. Basically, it's always growing, okay? So basically, you're adding things to that file all the time. So if you have a particular location, if you have a particular storage area for patient files, you have to keep expanding. And basically, this is a big problem, basically, because sometimes you run out of place, you run out of space, basically, okay? And as we're going to see, we have a requirement to keep the patient records for a long time. So basically, you cannot just get rid of the patients who don't come within a year or something. No, you have to actually keep their data for many years. Maybe 6, sometimes people keep it for 10 years. So this is a big problem. So you have the paper cost, in addition to their storage. Imagine also that you're going to try to retrieve it, okay? So the patient file is somewhere in that big room, okay? And basically you actually grab that file for a doctor to look at, and the doctor forgot to return it, okay? So basically he kept it and it was never returned. If another doctor needs that same file, it's going to be a problem. Also, imagine that you are trying to basically arrange them on shelves so that you can access them very easily, okay? Like, for example, you have, you arrange it by names, for example, okay, by alphabet, okay? Sometimes some of the letters would have more names than others. So sometimes you run out of space for a particular letter. Where are you going to put the other, the newer ones, the newer files that are coming with that initial, for example? It's a big problem, basically. Whenever, imagine that you're going to a library, and basically if you try to go to the, King Abdulaziz Library, for example, and try to find a textbook, I actually, several times, I find the textbook to be on the electronic system to be placed in a particular shelf. And I go there, I never find it, okay? And if you try to find it, sometimes when they return it back, they don't put it where it belongs. You put it somewhere else. And in order for it to be retrieved and placed in the correct position, sometimes it's extremely difficult. So the likelihood of losing, or basically for this patient file to get lost somewhere, is much higher when you have a file, okay? And it's not very convenient actually to have a very large file for a patient that has a lot of conditions. Basically, some patients actually, especially the elderly, they almost have very large, very thick files. So basically it's very inconvenient to move around with that kind of file, basically. And basically sometimes it's very likely for that to be misplaced, and basically it's going to be a big problem because this is the only copy. You have only one copy, and it's hard copy. If it gets lost, it's a big problem. So the patient doesn't have a file. Okay, so basically this is very important. Also, the time that you're going to use for the clinical staff to bring the files from the storage room and return it back and things of that sort. And sometimes even when you get the file, in order for you to look up something within that file, it's very difficult. Okay, so basically it's instead of just if it is in electronic form, you can just search for all the conditions or all the lab results, for example. You can get it right away with a click of a mouse. Okay, here you have to look for papers. You basically have to keep flipping papers within that file until you get to the lab results, and sometimes you can miss a few of them. Okay, so basically it takes time for the clinical staff to get that file from the storage and basically prepare the content for the doctor to look at. And basically sometimes you miss something, sometimes you something gets destroyed or gets lost somewhere, and this is the big problem. If you allow the patients or allow the clinical staff to focus on whatever they do, for example, it's a nurse, then it's better to take care of the patient rather than looking for files and flipping through files. Okay, so basically, if you have an EHR, then it's very likely that you will have lower healthcare costs, because basically the clinical staff will be, if you have lower number of clinical staff, you will be able to do their job because you don't have any, you don't have to waste their time trying to get files and look at files and basically looking for a missing report in a file or things of that sort. Okay, so this, of course, will be translated to better patient care. Yes.
Doctor, what I think is, I mean, you maybe have lower healthcare costs, but nothing comes without a price. Meaning that you have some costs for like some data storage or database size and those things related to technology ways.
Yes,
and
but
also
yeah,
we have
less,
some issues like sometimes file is disappeared or some data.
No, we're going to talk about this. Going to talk about the problems with EHR right now, and you're going to see that the one of the standards of EHR requires that you have a complete backup of all the data that is not accessible to anyone. So basically, you have to keep the confidentiality and the availability of the information, and the securing the information is one of the very important things that we have to take care of in EHR. But you are right, because basically what we're going to talk about now, one of the barriers to EHR is basically you're talking about this now, okay? Lack of trust and safety, okay? Some people actually, like what you said exactly. Basically, you're worried about missing, if you have a virus, for example, then you would lose all your data, right? Actually, this is one of the things that people actually are aware of, and basically they actually have a lot of things to basically solve these problems. There are multiple solutions that you can use to basically take care of this. And the storage of data is much less expensive than storing files, like storing like hard copy files, much less. Okay, so basically for the same cost, of the hard copy storage, you can actually have much more storage capacity in the electronic form than the hard copy form. Okay.
Okay.
So let's talk about the barriers to EHR. And basically, I think we should stop at this this topic today. You just finished this and stop like here and basically continue next time. Basically, in the first days of EHR, when people invented EHR and tried to convince people to use EHR, the main problem was that the EHR didn't have any standards, meaning that if you have an EHR system from company A and another from company B, okay, they would not be compatible. Basically, they build their systems without any provision for compatibility with another system. So this was very big problem. So basically, you lack compatibility, you lack interoperability. Interoperability meaning that if you have an EHR system from a particular company and you're trying to retrieve patient information from another hospital that has an EHR from company B, for example, okay, you will not be able to do that. The systems are not interoperable. They do not work together. Okay, you had major problems about data security and privacy. Security meaning that the data can be destroyed. Okay, so basically you're worried that the data might not be available whenever you need them. Privacy means that some people who are not authorized can access the information, which is really a big deal. Okay, basically patient information, patient medical information should not be accessible. Okay, so basically this was a major issue. Okay, there were no standards that would govern that. A major issue was also the downtime. Downtime meaning that, at least let me give you an example from some back history, not exactly in the EHR field, but whenever some places actually, when they move to computerized systems, you would have a problem because you would go there instead of standing in a line to do your whatever you're trying to do in a paper form. Okay, you have to stand in a very long line to be able to do that in a paper form. Okay, whenever they move to an electronic form, you find that you're still waiting because the system is down. Okay, it tell you that the network is down. Okay, or whatever. Okay, I think you may have things of that sort. Maybe I'm not sure actually, but here basically the system became a little bit better in the recent years. But before, sometimes you go somewhere, you go to like you're trying to do a certain muamala somewhere, some paperwork somewhere, and basically they would tell you that the system is down today, and basically we're not sure when it's gonna come back. Okay, so basically downtime was a major issue because basically the servers were not properly designed. They were like ad hoc. Basically, people designed systems that did not meet the downtime or the uptime. In the other words, it was not meant to be working all the time, and people did not design it to be operable 24 hours a day, basically. The clinical support was also a very important thing. Basically, some systems actually were designed without the feedback from the clinical staff. So basically, the systems may have information, but they are not really very convenient for the clinical staff. So this was a problem actually. So basically, this was a problem at the beginning. Now it's not there. Basically, the standards are there right now. Maybe we're talking about the standards. Maybe they were introduced like 20 years ago. Before 20 years, like in the 90s or something like that, this was a major problem. Okay. The standards are now in place, and basically all these issues are regulated by the standards. So any software that has that works in EHR has to meet requirements that would make these problems basically disappear. One very important thing, which is probably very important to maybe managers, okay? Imagine that you're going to a hospital, that this hospital has been working for a while, and it's a big hospital, it's a private hospital, okay? And basically the owner of the hospital is the manager, okay? And this hospital was working with paper patient files, okay? They have patient files as papers, as basic hard copy, okay? And you're working in that hospital in the biomedical engineering department, and you actually decided that EHR is a very good option for this hospital. When you go to talk to the manager or the owner of this hospital, you would tell him that we're going to replace the storage, the hard copy storage, we're going to convert it to electronic form and store it on servers, okay? So basically, whenever you do that, as you said, there are other costs. Basically, the initial cost, the setup cost of this system would be basically have to pay. Basically, it's you pay it at the beginning, and then very much you just have a running cost. This running cost is much less, but you have to pay a lot of money to just get this EHR started. So basically, you're asking that manager or that owner that we're going to have patient files exactly the same way. Okay, the same exact patient files are going to be available electronically, but you have to pay like 10 million reals, for example. Okay, so he would tell you it's exactly the same information here and there in hard copy or in electronic form. You would say yes, it's exactly the same. So basically, he say no. Basically, it doesn't make sense to pay 10 million reals and basically have no additional return on investment. Return on investment meaning that whenever I pay 10 million reals, I would like to see that as revenue. You're not going to see that as revenue, okay? Because basically you're going to just keep the files somewhere instead of in a storage room as a hard copy. You're going to store it in a server as electronic form, okay? Maybe on the long run, it's basically the advantages of the to the patient care and things of that sort, they will be there, but actually for a manager who looks at numbers or profit or things of that sort, he might not see that, okay? So basically, first of all, you have an unknown cost. Whenever you start a project like this, by the way, it's very difficult to assess exactly how much money you would need to implement an EHR. By the way, all the medical informatics solutions are extremely difficult to basically estimate how much it would cost. Sometimes you start with certain information from the hospital and you end up, basically, you find the reality to be very different. So sometimes the cost is not very much known at the beginning. So basically, it's an unknown cost. And the return of investment is not clear. Okay, meaning that the additional income versus the cost of the EHR software and hardware and implementation and maintenance and training, basically, you don't see that. You're not going to be able to make a case to the owner of the hospital that if you pay this money to move to EHR, you're going to get additional income of that much. Okay, so basically, this is a kind of a difficult case to make to an owner. But actually for the patient care, it's definitely much better. But this actually is not gonna be basically directly visible to the owner, okay? So basically, it's, as you go along, basically the reputation of the hospital for giving better healthcare delivery to the patients would actually make the profits become higher, but it's not going to be visible at the beginning. So this was actually a very basically what I would call a barrier for people to actually adapt EHR. This was like at the beginning of EHR. Okay, now I don't think anybody with the right mind would actually think about having the file cabinet or a hard copy storage for the patient files rather than EHR. Basically, all the new hospitals now adapt EHR. Okay, if you actually think about the changes that happened in the last 20 years, maybe 20 years ago, most radiological examinations were basically given as films, basically, okay? Now, most radiological examinations are in electronic form already, okay? So basically, it's extremely difficult to, or basically, it's much easier from the other way. It's much easier to basically store it in an electronic form rather than trying to put it on a CD or on a DVD or whatever. And especially because actually if you put it on a CD or a DVD, it's very likely that it will be corrupt by the time you would need it, basically to look at it. Even if you need it, now it's very difficult to actually find a CD drive. Basically, it's not very common right now. So basically, at the beginning, there were some doubts from the owners or the hospital managers about the cost that would be required for an EHR to be implemented in the hospital, which would include the software, the hardware, the implementation in the hospital, basically where you're going to put the terminals and who is going to have access and things of that sort. And of course, if you have a system that has software and hardware, you're probably going to have maintenance because of the hardware or basically the updates to the software. You have to train the staff, things of that sort. So basically a lot of costs at the beginning. This is the setup cost.
لو تسمح لي دكتور في مشاركة بسيطة.
Go ahead.
في إشكالية برضه أنا لاحظتها ممكن نتناقش فيها اللي هي نفس الايدنتيتي حقت البيشنت. لأنه مثلا نتخيلها إنه لو شخص مثلا لو أنا رحت مثلا إلى مصر، فلو اتبعنا رقم الهوية الايدنتيتي حقي فحيكون يتشابه مع شخص ثاني. فعندنا إشكالية حتى على مستوى الهوية من ناحية وزارة الداخلية مثلا، إنه لو جاء الشخص مثلا راح من السعودية إلى مصر ممكن يستعملون المفتاح حق البلد، مفتاح الهاتف مثلا 966 ويكون بعده رقم الهوية. هل تتوقع دكتور إنه بيكون يعني يونيك نمبر على أساس إنه لو سوينا
This is very important. This is a very important question actually. The thing is, if you're talking about the EHR, the patient has access to his file. So basically he can download his file and share it with whoever he wants. Okay, so basically it's not going to be like a common network in the whole world. It's not like that. So basically here within the kingdom you have a network that might be with the patient or with the national ID. Okay, but if he's going to travel, then he would take with him the patient file, or basically he has access through an app to his patient file, and basically he can show that or basically allow his doctor anywhere in the world to access that patient file so that he would actually access right away his file. Okay, so basically the patient here is basically making that connection. Okay, so basically I cannot say that there is a universal EHR that can be accessible from anywhere in the world. No, there is no such thing. But you can actually work through patients and through apps that the patient might have that would allow him to basically do that. So this is actually one of the things that are very difficult because sometimes the regulations might change from one country to another. So basically, whatever medical data should be accessible might change from one country to another. So basically, it's very difficult to have a universal EHR for the whole world. So basically, I'm glad actually that you're interacting because this is very important. And basically, I think in the kingdom here, there is a move to move everything digital. So basically, one of the things, if you're going to really implement patient files in electronic form in the kingdom, then a lot of these things will be relevant to you. You will understand a little bit more about what's going on, and you'll be able to basically realize what is being done, and whether there are things that can be done better, or things that are done properly, and basically know how to interact with them. The third barrier is the difficulty to operate. I'm not sure how many of you had the chance of interacting with doctors and nurses and people from the healthcare sector. But actually, some of them are really, first of all, they are all very busy. If you talk to a doctor during his hospital shift or something like that, he will barely have time to talk to you, okay? And usually he doesn't like to change his routine, okay? So people were at the beginning, maybe 20 years ago, doctors were not as literate with computers as right now. Basically, now actually doctors are very good with computers, okay? And the availability of such things as smartphones, things of that sort, made a lot of people actually more aware or more educated about how to use electronic systems. But before, basically, if you tell a doctor that instead of having to, or basically instead of prescribing the medication on a piece of paper, like most doctors do, which is very easy to them, he has to sit down and type the medications on a keyboard. This is really cumbersome to them, okay? Some people actually don't like to do that, okay? If you actually remember, I'm not sure if any of you was here, when the medical services here at the university, the Medical Services Center moved to electronic prescriptions, maybe a year and a half ago, something like that, maybe 2 years ago. The doctor used to write their prescriptions on basically prescription paper, and now they have to type it on a computer, okay? So basically, at the beginning, they were not happy. But at the end, all of them do it right now without any problems. But actually, there's a barrier, basically. If you tell somebody that you have to do things that you have been doing for maybe 10 years in a different way, he might be reluctant to do that, okay? So basically, this was one of the things that made EHR a little bit slow at the beginning, okay? People perceived EHR to be difficult to operate, okay? So people like doctors think that it's prescriptions is very easy to just write on a piece of paper, and basically in order for the doctor to look at a radiograph, it's easier to look at a film instead of looking at a monitor, okay? And basically some people actually perceived it to be actually more accurate to look at the film rather than look at a digital image, okay? So now it's very different. Now, because of the advancement in hardware and also the progress that was made because of the presence of smartphones and the widespread availability of laptops and things of that sort, I doubt that there is a doctor right now who doesn't like electronic form, basically. Most people would like to, it's easier for them to have everything in electronic form rather than in a piece of paper, basically. So basically, this was one of the barriers. Some of the things also change, which is basic. Whenever you have an electronic system in the hospital, it has to change the whole processes that happen in the hospital, the whole clinical processes that happen in the hospital. Meaning that, okay, if you're going to have an electronic prescription, for example, okay, the electronic prescription would go directly to the pharmacy. So basically the pharmacy would know exactly which medications are needed. And if these medications are low in quantity, they would order right away in electronic form also, so that they keep the storage quantities available, basically, of all the prescription drugs. So basically, it's very different. If you have a paper form, then whenever you do that, whenever you go and basically get your medication from the pharmacy, you have to periodically do like an inventory and see which drugs are not available, or whenever the drugs becomes unavailable. So basically the doctor would go and try to find that particular prescription drug, and when he find it, he would report that it's not available, so basically he would order it. But in electronic form, it's much better actually, because you would know ahead of time that this prescription drug is low in quantity. And you would know exactly, you have a record of how many times it was ordered. It was basically how many units are usually used every month. So you would be able to know when exactly you have to order in order for the quantities to basically keep, you avoid having the quantities go to zero before you order a new one, okay? So basically this is very important. How the information is basically exchanged between the different places in the hospital also change when you have an EHR. For example, if you order a particular lab analysis, for example, lab test, okay, this would also be reported through the electronic system. The patient doesn't have to go and take a piece of paper from the doctor and go into the lab part of the hospital and basically just start the process there. It's already there when you have an electronic system. So basically the way the information is exchanged would make the clinical processes much more efficient. Okay, so basically this is much better actually. And also if you have, for example, if that patient is seeing another or referred to another doctor by the primary care physician, if, for example, the general practitioner suspected something and basically referred the patient to a specialist, for example, okay, the specialist can actually look at whatever record of the patient, electronic record of the patient, and basically know exactly why he was referred, this patient was referred to him. And this would make things much easier, much more efficient, okay? But actually, the way it is, the way it was, because of the lack of accessibility of the EHR, or basically the new way of doing things in the hospital, sometimes there is a resistance, okay? Sometimes you know that this is better, but actually don't like to change. And unfortunately, the medical staff are basically among the people who are hardest to change. Let me give you a story about how medical personnel are very hard to accept new advancements. You would not imagine that, but actually this is a true story about CT, computerized tomography, okay? Of course, all of us know now that computerized tomography is much better than plain X-rays, because basically you can get a cross-section. When CT was invented in the 70s, and basically people, the medical doctors saw the images, they didn't like it, okay? They saw that basically instead of having a film with almost infinite resolution, you have a very limited resolution. Basically the first images of computerized tomography were actually much lower in resolution than the plain X-rays. Plain X-rays actually have really, because it's an analog medium, the resolution is really high, okay? They didn't see the advantage of having a cross-sectional image, which is very much revolutionized, basically made the diagnosis much more accurate than having a projection image from an X-ray, okay? So basically they resisted CT. Doctors resisted CT for a while, okay? It kept like that until maybe 10 years later, basically they started to accept that you can diagnose things that are difficult to diagnose with X-rays using CT. So basically for something that was really clearly basically very new and very powerful, a very new idea, the things that were never imagined before to have a cross-section rather than a projection image, basically they still resisted that, okay? Even though it's extremely powerful, it has potential at least, okay? They didn't see the potential, they saw that the process of diagnosis would be different to them, and they don't know how to do it, so they don't want it. That's it, very simple, okay? Here it's very similar. Electronic exchange of information is really very efficient, but it's different from the way they are used to. Basically used to having a conversation with the doctor and basically discussing that patient and basically getting the information from the old doctor, for example, okay? This is very inconvenient. You cannot do that all the time, and you cannot wait for that patient to, until you meet that doctor, whenever he has time, or whenever you get the chance to meet him and then get the information and then treat the patient. You cannot do that, okay? But still, this was the way things were done for a long time, and they didn't want to change that. Just as a general comment, whenever you have a change in the clinical processes, it will be met by resistance in general, whatever it is, okay? Even if it's very clearly to the advantage of the patient, if it has a certain new technology or whatever, there will be a resistance if it involves certain changes to the way doctors are used to do things. Okay, so this was one of the barriers that were facing EHR at the beginning. The thing that we talked about at the beginning, basically because of the comment of your colleague, basic lack of trust and safety. Trust meaning that, is this the same data that I stored? Nobody played with it, okay? Whenever you store something in electronic form, you have suspicions that somebody might change the data, okay? So for example, you might play, maybe some hacker or something like that went and accessed that data and changed the lab results, for example. And basically this would make the diagnosis different and make the treatment different and might cause harm to the patient. So basically, if it's in a hard copy, then it looks a little bit more authentic to the doctor, okay? But actually, at the beginning, they were worried about whether electronic forms are trustworthy or not. Whether they are safe or not. Safe meaning that, are they going to be destroyed? Would it be possible for the hard disk to be erased, for example, or the hardware to fail or cause loss of information, things of that sort? Basically, you have concerns about the security of the electronic record, alteration without the doctor's consent or knowledge. So, for example, if the doctor prescribed a certain medication, can somebody go in the system and change that to another medication? Okay, this was a concern. Basically, if you talk about the safe storage, basically you're talking about loss of data due to power outage, due to computer crashes, due to viruses, things of that sort. Power outages, of course. This was a concern because sometimes, at least maybe 20 years ago, computers were not as reliable, storage devices were not as reliable, things of that sort. Basically, people are worried that the data might be there, but might not be accessible when you need them. So basically, this was a concern. Right now, actually, we're going to see the standards that are going to be used for EHR and realize that they address all these things. So basically, you have storage devices now that would allow the data to be stored in a redundant way, so that if a device fails, it would not affect the data. We're going to talk about this actually when we talk about PACS, for example, at the end. We're going to talk about RAID storage, random or redundant array of independent storages, okay, or independent drives. So basically, we're going to see that it's possible to actually store the data in a very safe manner without any problem. And technological encryption allowed people to store the data without having somebody else access it or modify it or things of that sort. And the standard would require anybody who actually access the information, if somebody is authorized, or for example, the doctor is worried that another person or another doctor in the same hospital who has access to the electronic health records can actually modify the data. Now, all EHRs have a certain log. Whenever somebody goes and looks at something in the EHR, it will be logged. So this person looked at this information at that time. If he modifies that information, it will be actually recorded. And basically, it would keep the old and the new ones. So basically, it would be known that the person who made the changes is this person, not anybody else. And also, there are levels of access authorization. So for example, if a certain doctor with a particular authorization level, okay, prescribes something, if a doctor with a less authorization tries to access that and modify it, he will not be able to do that. So basically, next time, inshallah, we're going to talk about the standards, some of the standards that are very much relevant to this EHR, and basically see that they are very much, basically trying to address the barriers to EHR and basically make things much more reliable, much more accessible, much easier to operate, much safer, and basically address the concerns of interoperability and things of that sort. So inshallah, next time we're going to start with HIPAA standards. Basically, we're going to talk about the history of the standards. I'm going to talk about the HIPAA standard. Okay? You have any questions? Okay, so basically we're going to be done now. Basically, the lecture is recorded. So basically, if you need to go back and basically look at or listen to the lecture again or look at a particular a part of the lecture, it's going to be there. I'm going to post first homework for this part of the course on Blackboard, and basically I'm going to also put a very small project just to get you started, and inshallah we will go over that homework so that you know exactly what you're expected to do there. Okay, so inshallah next time we're going to continue on that topic, and basically the homework will be there, and you basically you'll be able to get a look at it so that you know exactly what you have to do. And basically, if you have any questions about the homework, you can ask me next time, inshallah. Okay? So I'll see you next time, inshallah, if you don't have any questions.
When the homework will be posted?
The what?
When the homework will be posted on Blackboard?
Inshallah, this weekend. Inshallah, this weekend, okay? But actually, it's not going to be due this weekend. It's going to be due after we finish, like in maybe 10 days or something like that. Okay? So 10 days after the homework is posted. We're likely to finish this topic next week, inshallah. So basically, you're going to have a week after we finish to submit the homework. Okay?
Okay.
By the way, the deadlines for homeworks and things of that sort are very flexible with me here. Okay? So basically, if you feel that you have assignments or projects in other courses, and you might not be able to meet the deadline of the homework, you just let me know and I'll delay it a little bit. No problem. Okay. I think somebody posted a WhatsApp group joining, right? You put there's a link for a WhatsApp group.
ايوه الشباب كلهم دخلوا بس باقي واحد اللي ما حضر المحاضره الماضيه.
I think everybody's here.
اي
Everybody's here today, or?
لو بس انضم للجروب.
Okay. I don't think he's here because actually we have 9 students. We have only 8 today. So I think he communicated with me. I think his name is Abdulaziz, right?
Yes, Doctor, I will join now.
Okay. Okay, so basically, I'm not sure if he's going to be. Basically, he told me that he has a family circumstances, and he should be able to attend the lectures or basically look at the lectures, the recorded lectures, but he might not be able to attend on time for probably the first 2 weeks. So anyway, so hopefully, inshallah, he will join you. But please keep posting the link every lecture so that he can get that information. Or basically, you can send it to me, and I'll send it as a notification to the whole class. If I send it through Blackboard, it should reach everybody. So just send it to me, or I can just copy it. I'll just copy it.
I will send it on WhatsApp.
Okay, please do that. Okay. Okay, so I'll see you inshallah next Sunday, inshallah at the same time. Okay. Shukran. Salam alaikum.